Thank you. Well, educators making those tough decisions as case numbers move in the wrong direction. Today, the state saw another jump in confirmed cases, 618 new cases reported. Now we are over 39,000 confirmed cases in all. No new deaths reported today. The three-day average in Colorado is now 495. The last time it was that high was May 1st, more than 2 months ago. We also saw an uptick in the number of hospitalizations, with 273 patients across the state. That is 13 more than reported yesterday. Now the highest number since the end of May as well in Colorado. Alan Janae joins us live in Denver tonight. And Alan, you've been talking to health experts about this swell in cases.
Yeah, and the deeper you dive into this data, Karen, the more you get soaked in a pretty tough reality. This is the result of our reopening, and I think it's safe to say one that we all believe that we want and we need. But this mountain looks pretty steep. Are you seeing an uptick?
We are now seeing an uptick. Over the last 48 hours, we've had a pretty big jump in patients.
Dr. Connie Price, Chief Medical Officer at Denver Health Medical Center, where there are nearly a third more patients in that short time. She has seen what's happened in states like Texas, where hospitals are running out of room and resources.
It is burdening their healthcare systems tremendously.
Dr. Price theorizes visitors from out of state may be part of the increase.
This increase at this rate is not sustainable?
That at the present rate of growth in these cases over the long term isn't sustainable.
Julie Lonborg of the Colorado Hospital Association notes there are still plenty of beds now, and there are alternative sites like the Denver Convention Center and the Ranch in Loveland still empty and capable of accepting hundreds of patients. But big outbreaks in other states mean preparations are getting tougher.
Our supply chain is a bit rocky again at the moment, and so we're not able to rebuild those inventories and those supplies at the rate that we had hoped. But for now, we do have enough.
With improving treatments, fewer may end up in ICUs, but hospitals are looking at a difficult reality.
But we are very concerned, and we're preparing, and we're getting ready to do what we need to do to accommodate another surge.
And that could mean things like suspending unnecessary procedures. That could happen. Now, remember, Colorado has done a lot of preparing here. There are a lot more critical care beds than there were earlier in the pandemic. And treatments have gotten more effective. They're definitely making headway. But this is still a fatal disease. And we have to be careful, Karen, that what we think might be the light at the end of the tunnel isn't some kind of approaching locomotive. In Denver, I'm Alan Janae, covering Colorado First.
All right.